Transitioning youth from the pediatric healthcare system to the adult healthcare system, it's here, it's necessary, it's a new way of thinking about care coordination. It's a process that starts very early on, and it's, again, grounded in partnership. The role of the pediatrician for a young adult transitioning into adult healthcare is critical. It's a vital piece of partnership. And when the provider can understand that in the pediatric system, many of the services that families have been receiving are entitlement based. And when they move into the adult system, it's eligibility based. And if just providers could know that piece, so they could begin preparing the families for how to look at an eligibility based service system when they have been in an entitlement based system, that would be huge. The role of the pediatrician is to serve as an ultimate care coordinator, basically. When we are preparing young people and their families to go out of the pediatric system and into the adult care system, the language is different, the players are different, the knowledge base is different. And so what pediatricians can do is to start helping the families as early as 12, 13, 14 years old. Help getting them to understand that you can't stay here forever, and that to understand that in the adult healthcare system, that young person needs to be a wise healthcare consumer. They need to be able to advocate for themselves as best that they can. And so therefore, the parents need to learn how to step back when it's appropriate. In my daughter's situation, she's nonverbal, and so she'll always have someone expressing what's best for her, whether it's me or my husband or her siblings or her care providers. But what's key for the pediatrician is to understand it's going to happen, and they cannot stay in a pediatric setting forever because the healthcare needs of the child differ as they grow. But we just kind of forget to think about that. And the role of the parent is to be able to move from being their advocate to being their ally, which is a slight difference in the way that you frame it, because the young person needs to learn how to speak on their own behalf. So there are like 3 things that we tell young people to consider. A, know your health history. B, always carry your insurance card. And C, know your body well enough that when something's not going well, you know who to call. And so pediatricians can help families understand that those are 3 really key ingredients for wise and healthy outcomes as they move into adult. And the role of the pediatrician is so critical, because where else are kids and families going to hear about this if they don't hear it from their pediatrician? And they have to understand that moving into the adult system is an exciting time in their life, and it's a different time. And for families who have kids with special healthcare needs, it's going to be a whole new group that are going to join the healthcare team. The medical home team quarterback may even change, and so will the other players, even though they, as the young person, remains constant in both systems. So the whole idea of transitioning youth right now is a critical piece of information and training that more families need to understand, and that pediatricians can be a part of providing that guidance.